coronavirus. The World Health Organization is set to announce this hour whether it will declare an international emergency as China reports an 18th death. This is the scene live in Geneva right now. We'll take you there as soon as medical experts begin speaking. I'm Andrew Nichols. You're watching CBC News Network. Also ahead.
It may have planted the first seed in their minds that, yes, perhaps the president did something very wrong here.
Democrats resumed their impeachment case against Donald Trump this hour. We'll take you to Washington for the latest as the Senate trial continues. And
Harvey, are you ready for Annabella's testimony?
confronted by his accusers, actress Annabella Sciorra gives emotional testimony against Harvey Weinstein. We are waiting for an update from the World Health Organization as it considers for a second day if the coronavirus outbreak is an international public health emergency. We'll bring that to you live from Geneva. 18 people are dead from the virus. The average age, 73. Here's the latest we know so far. Wuhan, in central China, where coronavirus originated, is on lockdown. Its 11 million residents are not allowed in or out. Outside mainland China, the virus has spread to at least 8 countries or regions in Asia. It has also crossed the Pacific with one confirmed case in Washington state near Seattle. The CBC's Aaron Collins is tracking developments live from London. So, Aaron, what's the benchmark to declare an emergency?
Well, it's high, Andrew. A FIC, or a public health emergency of international concern, it's a big deal for the World Health Organization. They've really only used this 5 times, and it's been for big outbreaks like Ebola, so big crises. Now, to declare one, they're really looking at a couple of key things. Is this situation unexpected? So did it catch officials off guard? That's a big one. And the second criteria is whether the outbreak is crossing borders, which would mean obviously it warrants an international response. And obviously, as you referenced there, that is happening. Now, complicating all this, though, for the World Health Organization is that they're really aware of the impact a decision like this can have on the global economy. Have a listen to the group's Director of Health Emergencies, Dr. Michael Ryan.
So the IHR as an instrument is specifically designed to ensure that the appropriate public health actions are taken to contain the disease without unnecessary interference with travel and trade. There's a balance here to be struck.
So it's a big decision for the World Health Organization, Andrew, and it's one they don't take lightly.
And how quickly is the virus spreading?
Well, you know, that's really the big question, isn't it? And it's not an easy one to answer. We're seeing new cases pop up across China. 2 new cases have just been confirmed in Hong Kong. Here in the UK and in other places around the world, they're looking into potential cases. So a lot of uncertainty out there. And health officials on the ground in China say sort of separating those potential cases from confirmed cases is really a tough lift. Have a listen.
We do expect the numbers to grow much larger because, as you might notice, the first cases were the ones that are more easily recognizable, and the earlier search was for those cases with severe condition, with pneumonia. This is because there's a seasonal influenza happening. So this is a virus that has emerged under the camouflage of millions of cases of milder respiratory infection. So finding the cases is actually quite difficult.
So, Andrew, figuring out exactly, how big this outbreak is, how quickly it's spreading, is certainly going to be part of the conversation in Geneva today, and we're waiting together to hear what they have to say.
All right, Aaron, thank you. That is the CBC's Aaron Collins in London. So far, there are no confirmed cases of the virus in this country. Officials in Quebec say they are testing 5 people for the coronavirus. 1 other person has already tested negative, and Quebec's Director of Public Health says he doubts any of them will test positive. And Federal Health Minister Patty Hajdu says this country is well prepared.
The risk still remains very low for Canadians in terms of acquiring this particular illness in Canada. The fact that there are some cases that are under further examination is actually a good sign. It's a sign that our system is working and that the public health and medical professionals across the country are working together and are following protocol. Dr. Tam, who you know is our Chief Public Health Officer, is working very closely, daily in fact, with all of the leads across the provinces and territories. That's also very good. And she's also working very closely with the World Health Organization and other international partners, and they are having daily meetings as well.